Welcome to Elevate Care. We are recording in front of our first ever live audience right here in Dallas, Texas for our Rethink Client Summit. We are really excited here to talk with Meredith Lapointe, our Chief Business Officer, and Pat McCall, Chief Growth Officer. We're talking all things healthcare, but particularly today, we're going to be focusing on solutions for workforce challenges, in particular with planning and flexibility. Pat and Meredith, welcome to the show.
Thank you so much. Great to be here.
Awesome. Okay, let's start with actually rethinking how we do introductions. Meredith, tell me a little bit more about your why. Why are you in healthcare? Why are you with AMN?
It's an important question, an important one to ask every day. You know, many of us stay in this industry because there's such a deeper purpose. For me, one of the driving motivators is just making healthcare better every day. You know, I think it's a travesty that you can walk into one setting of care, one hospital, one place, and potentially where you walked in could dictate the outcome that you walk out with. I don't want that to be the case. I want it to be best chance of having a fantastic outcome, meeting amazing caregivers, having access to quality regardless of where you step in. And that's really one of the things that motivates me. And you know, I worked for a couple decades in healthcare consulting and moved over to AMN because I saw a company with all of these pieces that enabled the right people to be in all of those places when they're mostly needed, when they are needed the most. So that really drives me and makes me very proud to work here.
Thanks, Meredith. Pat, same question.
I would say, you know, from my perspective, you've got, you know, my career has been around human capital and human capital tech, and getting people jobs is a really important thing. But when the job that they do is delivering care to patients, that elevates the purpose and mission that I have. So I've found a lot of purpose coming from outside of healthcare into healthcare, and what our caregivers and clinicians do every day, and the fact that we facilitate that.
Awesome, and thank you for that subtle plug with saying care and elevate. Good mnemonic, appreciate that. Okay, let's get right into the topic at hand. So workforce. We're all in this room here familiar with that topic. In fact, we could probably have a wallpaper with workforce just listed all over it. But I'm hearing more and more about a balanced workforce. What does that mean and why does it matter?
You know, it's a complicated term and it's only getting more dynamic. So when I think of a balanced workforce, I think of, do you have the right number of the right people with the right skills, with the right level of, you know, sort of flexibility to be where you need them at the times you need them. You know, two components of that I think are really interesting. One of them is around, as you think about getting the right balance on teams, what are some of the capabilities we have now of actually saying, what are the skills, what is the tenure mix, what is not only just the basic skill mix, but the dynamic mix between those teams, and how do you balance that out, and how do we use technology to better meet those needs? And then second, you know, with the imperative to really meet dynamic demand of patients, whether it's seasonal or sort of hourly or different acuity, things that we're seeing over time. How do you have the right people with the right flexible either schedules or willingness or excitement to be there? And how do you balance that in a way that lets you, you know, optimize your cost, quality, and your experience as you're doing that?
Okay, that's great. The last few things you said, really talking about what happens if you do this right, and you mentioned cost. Pat, do you have any thoughts on how that workforce balance is helping from a cost perspective?
Yeah, I mean, from my perspective, all of the leaders that I talk to, cost management is, you know, it's a prime factor, and you know, you're balancing resource needs, and those are balanced with care delivery needs. And whenever you're doing that, and you're doing that effectively, and you have the right mix model for your workforce, you're going to have the best cost management as well.
Mm-hmm. Okay, so we talked about mix and model. We talked about that it helps with cost. Easier kind of said than done. How do you do it? What's a key enabler for a balanced workforce?
So there are a lot of pieces. You know, as I think about balancing a workforce, you have to start at the very beginning. What do you actually need? What's the demand as your system's evolving, as you're opening up, you know, out of hospital settings and building out your entire capabilities, in person and virtual, really across all aspects? what do you really need? What are the number of people? What are the types of people? What are the dynamics between people? What are the skills that you need today, the skills that you need tomorrow? So that planning component, is where I think several folks do some planning, but not necessarily the robust dynamic planning that'll really set you up for the entire process. Because from there, you get into, all right, let's do our planning. Then let's figure out hiring strategies, retention, recruitment, people strategies. Then let's figure out how we actually have schedules and predictive schedules. What does that look like to actually connect from a technology perspective into other systems? And also, what are the functions or what are the structures that you put people into that let you have flexibility? Are there float pools? Are there different training programs? We had a great conversation last night at dinner around, rotational training and how you can really get folks to understand different aspects. And does this then appeal to this generation of healthcare workforce in a way that you really can't do another way? So there are a lot of components to it, but I think starting the beginning and then going all the way through, as seamless as you can make that entire planning and operationalization process, better.
Mm-hmm. And just as we were talking about WorkWise and integrated, technologies, it is a lot to come together. It is a hard thing to be seamless and to have that frictionless experience. Maybe Pat, can you talk a little bit more about, the technologies or the underpinnings of helping to create that frictionless experience?
Yeah, I mean, when I think about frictionless, you think about all the stakeholders that are involved. So whether it's the clinicians, it's folks that are hiring. You have to think about that experience, and it's facilitated by technology and integrated technology. We try to think about it, I think, in sort of 4 key components. There's obviously a technology layer that you're going to have. And in a lot of cases, that's workforce technology like VMS. Then you're going to think about the program itself, the program that you run, and that's an in-source, outsource decision. So whether you want to manage that process yourself or you want to have AMN manage it or somebody else. And then you think about the supply strategy around that, and that is very much, I would say with supply strategy, it's category and location dependent. So you're trying to have a calibrated supply strategy. And then you have to wrap it all in governance. And governance is really important because you want to make sure that the outcome that you're after is co-owned by, if it's AMN or whoever your provider is, and you. So it's very critical that that co-ownership happens. But it all goes back to that original foundation of technology enablement.
Mm-hmm. There's a lot of threads that we could pull there. Before I do, though, Meredith, is there anything else that you'd like to add on this topic?
I think as I, hear about the technology and the enablement, and this might not be smiled upon in a live podcast, but how many of you have a lot of point solutions where you're finding a lot of these solutions have to be, you go here for this, you go there for that, you have to log in again. Anybody? Yeah. We can't have that. It's too complicated. The more that these systems can actually integrate, talk to one another, create an experience that is easy to navigate and also takes into consideration those pieces of data that you really don't want to miss, that's very important, especially when it comes to workforce. It would then allow us to say, well, what are folks' preferences on scheduling when we're actually trying to fill a schedule? Or how can we ensure that this patient is actually matched with the right person? Without having to, have someone check here, check there, document 4 times. So point solutions are dead, and very excited about what the future holds with integrating this technology.
Yes, I can barely remember passwords to log into my own system. So, and you're always re-authenticating. Thank you for the security, appreciate that. But so I guess going back, Pat, you mentioned specifically VMS, mm-hmm. and you mentioned specifically, vendor neutral. I think I've heard some potential misconceptions or rumors. Talk to me a little bit more about, can a staffing company or a company that has a staffing arm truly be vendor neutral? What are some of the, truths and misconceptions there?
First of all, I think it's a good question, and it's a very fair question. The way I would think about it, and a little bit of this is my past informing my present, but staffing firms in general have very, very deep expertise in how to find, recruit, retain talent. So that's a that's a core premise of these programs. I think the other thing, and I mentioned this before, is governance. So when you have a program and you're running it with a provider, whomever it is, the client has a responsibility and the provider has a responsibility to ensure that the outcomes that you're planning are actually being achieved. So that is really, I think, a key component. Then the other, if we go back to tech, if you have the right tech, you're going to generate the transparency, leverage, control that you're after with your program. So you generate the transparency that allows you to have good governance over the program with the technology itself.
Okay, so vendor neutral, obviously a very attractive option right now.
A lot of energy about it.
A lot of energy about it. So what are the most successful models that we're seeing out there?
I really don't like to think of it in a binary, whether it's what we used to do versus vendor neutral, or I do think there's not a one-size-fits-all environment that we're in. The talent environments are becoming much more complicated. We're thinking about talent much more holistically than we used to. And so I would say, what we see more often than not is, rather than a pure vendor neutral model, we may have vendor neutral as a part of the program delivery. I mentioned category and location specific solutions before. And you could have, for one category of labor, you could have a master supplier. For another, you could have vendor neutral, and you can have them in the same program. So this is, I think, that calibration to the need and a more sophisticated need is in order.
Okay, great. Meredith, anything to double down on or add to?
You know, it's interesting. I feel like so much in healthcare comes in cycles, whether it's accountable care organizations or, the vendor neutral versus master supplier conversation. At the end of the day, what I see is health systems want reliability. They want great people to reliably show up when you're asking for them with the right skill sets, with confidence that this individual is not only credentialed, but motivated and wonderful. And also it simplifies the process for that health system to do it. So I find that as we go back and forth, at the end of the day, it's really, do you have a partner and do you have technology at the core that are going to make this easy for you, that are going to ensure the right people are showing up at your doorstep, excited about your health system and excited about caring for your patients.
Awesome. Pat, a little bit of a non-scripted curveball. Hope you're okay with that. But you come from not healthcare, but you're in healthcare. Can you give a little insight on maybe some of the trends you saw in commercial and maybe how you're seeing healthcare follows?
Yeah, it's interesting. So in the world that I inhabited for many, many years, actually the original construct was neutral, like a pure neutral model. And we moved away from that over time to a more moderated approach and a little bit more calibrated approach based on the category, location, dynamics of the labor that we were going after. So I think that, you're going to see those sorts of changes and evolution in healthcare as well, where you're thinking about the workforce, as I said before, a lot more holistically, and thinking about it not just nursing, not just locums, not just non-clinical, but thinking about that in a holistic program.
Mm-hmm. So what other considerations, should people be thinking as they're choosing a model or as they're choosing a company or as they're thinking about even technology to engage on?
Yeah, so maybe I'll just double down on some of the stuff that Kerry said earlier. We're a public company. That carries with it a lot of responsibility and regulatory oversight. And we are doing a lot of some of the things that people don't see, the non-sexy stuff. So whether it's having a comprehensive MDR, doing the rapid pen testing, all of those things, SOC 2 compliance, those are things that they really matter. And they especially matter in the threat environment that we have out there today, because cyber is just something that I think keeps most executives up at night.
Mm-hmm. So we've covered some large topics in a pretty short amount of time. What did we maybe not dive into deep enough that you want to give just an extra little bullet point on before we talk about what's next?
It starts to get into a little bit of what's next.
Yeah, go ahead.
But I'm excited about as workforce evolves. So you think of this imperative around a balanced workforce to just meet your demand with the right supply. As we start to evolve and as different technologies advance, really attacking at that intersection where we can make things more efficient or where we can make it just easier for folks to do their jobs, whether it's for a manager when, an automated system is actually just going through the flow of, hey, so-and-so can't come to work today. I've automatically gone through in order of preference and list, folks who haven't worked their designated hours, folks who, have not yet hit overtime in a part-time capacity, contingent workforce, folks wanting to pick up an extra per diem shift, whatever order that is, it does it for you. You just get a text saying it's been solved, you're good. That component, and then as we really start to look forward, what are the efficiency enablers at that point too? One of the areas that I'm excited about, and if you saw me giving a hug to the bright green machine in the hallway, don't mind me. But our language services, the ability to bring video interpretation to the bedside immediately in so many languages and just with zero hesitation, it saves, patients time, it reduces length of stay, it reduces wait time in an emergency department. It makes the interaction more efficient and it makes it more delightful for the patient and for the clinician. So more of that as we evolve. What are those efficiency drivers? Where are we actually using technology at those points of intersection in a way where we are no longer going to have such a big gap between supply and demand because we've actually attacked it at the center.
Mm-hmm. Love that. Pat, same for you. What's next in your opinion?
Yeah, I've been alluding to it a little bit in my comments. I do think that sort of the siloed world of talent, that those silos are going to start to break down. You're not going to have nurse-only solutions, physician-only solutions, non-clinical solutions. We look at even some of the functionality that we're building into our tools. And we have the ability to do multi-category programs, bring in non-clinical spend, statement of work spend. So I do think that we're going to see sort of a convergence of programs and how they become a lot more holistic and bring in a lot of different talent delivery models. Both for permanent hiring as well as contingent labor. So it's exciting to sort of watch it unfold. We've had design sessions where we've sat down with our design team. A shout out to Will Morse out there, and we've started drawing pictograms of our programs, and you can see that they are becoming much more holistic and much more focused on all categories of labor.
Excellent. Lots of stuff to continue to dive into, but we will kind of cap it there for now. We'll also have to maybe insert a picture of this green machine that you were talking about so people have a reference point. But Meredith and Pat, thank you so much for joining us on Elevate Care today. And to our listeners and viewers, please find us anywhere you subscribe to your favorite podcast, Spotify, etc. And we look forward to you joining us next time on Elevate Care. Thank you. Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.